have you been on fully carnivorous diet for that long, or mostly carnivorous?
No, I'm an accidental carnivore.
Okay.
I didn't start doing this because I saw any type of nutritional superiority. But I've never believed that there was a reason why you have to eat plants. As far as I'm concerned, plant is just variety. And after a while, it became such a pain in the butt, I just stopped eating the darn things.
And how is that? I assume the negative effects on it hasn't had any negative effects on your diabetes, has it?
None whatsoever. Compared to other well-controlled diabetics, I'm probably right up at the top of the list. I'm lucky. I'm very consistent.
And your hemoglobin A1C, you mentioned the first one was 4.9. What does it typically run over the years that you've been doing this now?
Well, 4.9 to 5.1, which is basically in the variation of the test.
Yeah, so basically
I could
completely normal A1C.
Well, I can hit any number you want me to.
Right.
You know, I don't really see a lot of value in hitting 4.5, but I could do that.
Yeah.
And I could do it without risk.
Yeah.
Because it isn't the low glucose that gets you, it's the excursions.
Well, yeah, that's what Bernstein talks, because, a classic endocrinologist will warn you against hypoglycemia because there's relations to dementia down the road. And Bernstein will argue it's because of the rapid fluctuations. And most people that have hypos are type 1s that are overcorrecting for, or type 1s and type 2s overcorrecting for carbs. And that's sort of the issue there.
And it's a moot point because I don't have hypoglycemia at a frequency any worse than any other type 1 diabetic.
Yeah.
It is a non-issue. It's an argument that they bring up because they don't want to change their guidance.
Yeah, I can see. I mean, I know there's some people say, well, we've had people that have had hypoglycemic comas and we don't want to get sued about that. And so I know there's kind of a CYA part of that. But at the end of the day, if you look at the ADA's current guidelines, their target range is between 70 and 180, 70% of the time. So, some people would argue sitting around at 180 all day long is not a good thing. And that, and only doing that 70% of the time, you could be even higher potentially is not
I'm
particularly
70 to 120,
right.
Probably 95% of the day.
Right. Do you, with diabetes comes the concerns about retinopathy, nephropathy, cardiovascular disease. Is that something you're monitoring or maintaining? Usually diabetics are, checking these things, periodically. Have you noticed any change with that stuff?
It's an emotional issue for me because I coach type 1s who have had horrible things happen to them.
Mm-hmm.
You forgot gastroparesis.
No, I didn't mean it, but gastroparesis, no.
Talk about horrible.
Right.
I had my eyes checked, and they did check and find that there was damage.
Mm-hmm.
I don't know the medical name for it.
Mm-hmm.
And I do know that I went back in 1 year later, and I said, I'm interested to see if any of this is resolved. And the doctor said, no, this doesn't resolve.
Right.
And then he did the pictures, and he had them up on the screen, and he's flipping back and forth between the two, saying, all kinds of strange noises. And then he turns and tells me, oh, yeah, it looks fine.
Yeah, it's resolved. Yeah, it's funny, I think this is a really important point. I want to just talk about this because you're not the first diabetic, and certainly not the first type 1 diabetic that I've run into that has done a low carb or even a carnivore diet, and they have had their diabetic retinopathy go away. And to me,
or at least improve
or go away or whatever, and to me, that is very, very powerful because the people will say that, well, low carb diets are just masking the disease is still there. To me, then if that were the case, the retinopathy would not improve. These things would continue to progress. It would get worse. But what I'm seeing is actual recovery of end organ damage, which is the whole reason we don't want diabetes in the first place. It's not because blood sugar is high. It's because our kidneys fail. We get heart attacks. We go blind. We cut our feet off. So that is really what we're trying to avoid there. And
supporting your point, it's not just retinopathy. I had peripheral neuropathy.
Mm-hmm.
It's gone.
Yeah,
completely resolved.
Yeah,
in this arm, in my right arm, and both feet. gone.
And did you
that's
have
no fun when the nerves start coming back, by the way.
when you had the retinopathy, was that, how long was that? Did you have that prior to the diagnosis of the official diagnosis of diabetes?
Yes, it's part of what made me end up going into the doctor's office. My son, I worked with my son at the time, and we went outside to the parking lot to talk. And I was talking, this was in Central Valley of California. And I just said, the fires are really, really bad. I can barely see down to the end of the street. And he just had this shocked look on his face. He says, Dad, there's no smoke in the air. You don't, it's much easier to see something in another person than to see it in yourself, because you compensate. You constantly compensate. If somebody tells you, look, dude, you need help, you're in trouble, please listen to them. Don't argue with them. Don't try and explain to them why they're wrong. Just go get it checked out.
Yeah, I think good advice there. And you mentioned, but you were talking about neuropathy, like you couldn't feel your hands. How long did that precede your official diagnosis of diabetes? Or do you think, did you have it for a few years, or was it something new?
Yeah, it creeps up on you. It started on the sides of my big toes.
Okay.
And then it started creeping up to the top of my 4 feet. And then both feet.
Yeah.
And then, and then you get the tingly numbs instead of just the lack of sensation. And then when the patch on my arm was the last one that developed, which was actually I think probably the gravest nerve damage, because I completely lost all feeling in that patch of skin between my elbow and my hand. It just sneaks up on you. It's hard to tell how long it presaged it, but it did. Yeah. I was probably in trouble for a good 2 or 3 years before diagnosis.
And then, like I said, probably during this whole time, your pancreas is slowly shutting down while this is going on. Any thoughts as to why because it's interesting, the type 1 diabetics, there's a lot of theories as to why that occurs. Some people think it's an infectious etiology, some kind of environmental damage, some people's genetics, but of course it's 60, you're probably, well, seems like late for that. Any idea why you think you contracted type 1? Is there any thoughts on that? Were you have an infection at some point, or what was the thought on that?
I honestly don't know.
Yeah.
I do know that teenage years I had viral hepatitis, not Hep C, the other one. I can't remember what it is.
Hepatitis A, perhaps. Yeah.
And other than that, really not a lot of problems with infectious diseases. I didn't really have a history of autoimmune issues, asthma, none of that. I hear people online all the time and say, oh yeah, COVID gave me type 1, or this gave me type 1. And they don't realize that whatever happened to you years before you ever see the symptoms. So that trying to make these cause and effect connections is really hard to do when you have a year to 2 years between observable effect and onset of difficulty. So the honest answer is, I really don't know. I really don't know. I was never a type 2 diabetic. Always thin, always, whatever the stereotypical non-type 2 was, that was me. I could sit down and polish off an extra large pizza and then turn around and go get another one and never gain a pound for the longest portion of my life.
Well, certainly. Well, let me ask you, are you still being followed by some sort? Is an endocrinologist following you, or is it a primary care physician, or who's sort of managing, prescribing your insulin, that type of stuff?
Person who I liked retired, and I just don't feel like breaking in a new one. These people know nothing about managing my disease. Right. They may be able to interpret blood markers or tests or these things or that things, but when it comes to what's important for a person's quality of life, they know nothing.